Welcome to PALi's lecture series. This lecture will be on peripheral artery disease and will also touch on acute limb ischemia, which is associated with peripheral artery disease. So, PALi is an atherosclerotic disease of the major arteries that supply the limbs. And so, in peripheral artery disease, the lower limbs are affected much more than the upper limbs. And so, I'll focus some of my attention on the arteries of the lower leg. The atherosclerotic plaques typically arise at different levels, and the bifurcation of the major arteries are typically where they arise. So this can be the aortic and iliac vessels, or at the bifurcation of the common femoral artery, and also the popliteal artery into the lower leg arteries. And so disease can present at any four of these levels, or potentially distal, or potentially in between each level. And this can produce different symptoms and signs. So the risk factors for peripheral artery disease include smoking, which is a major damager to endothelial cells. Hypertension, again, damages endothelial lining. Diabetes, coronary and renal, as well as cerebral vascular disease, can coexist with peripheral artery disease because of the same pathophysiology of atherosclerosis in the vessels. And also hyperlipidemia drives a lot of the atherosclerotic change, and this is a disease that affects typically older patients. Symptoms of peripheral vascular disease are classified by the Fontaine classification system, and stage 1 is an asymptomatic patient. So there is evidence of disease if they are imaged, but there is no signs of disease symptomatically or clinically. Stage 2 is intermittent claudication, and this is cramping pain that the patient gets either in the calf, thighs, or buttocks, and this is brought on with exercise over a given distance or for a given time. The pain comes, it leaves with rest, and then when the patient starts to exercise again, it comes back after that same distance or that same time. Where the pain arises can indicate the level of disease, and so pain in the calf typically indicates superficial femoral or popliteal disease, and any pain in the buttock or the thigh indicates any aortoiliac disease. The next stage is rest pain, so patients will not exercise, they have pain all the time. Typically the pain will come on when they're in bed with their legs up. They'll wake up with pain, they'll swing their legs out of bed, and that will be the way in which they relieve the pain, because gravity helps the blood get down to the tissues and relieve the ischemia. They will sometimes say that their legs turn pink or red, and this is a reactive hyperemia that occurs. And then the last stage is tissue loss and gangrene, and so this is indication for surgical treatment or potential amputation of the limb. Of disease include cold limbs, the white, pale looking legs, atrophic skin changes such as loss of hair, some tissue loss, thickening of the nails of the feet. There's an increased capillary refill time, so this can be very markedly increased. There's a weak or absent pulses, and again, the level at which the pulses disappear can indicate the level of disease. There's sometimes ulceration, so punched out arterial ulcers that are very painful, and tissue loss either in between toes or around ulcers. And then this Berger's test is used and to indicate if there is reactive hyperemia. And so Berger's test is where we lift the legs of the patient up to 90 degrees and noting when the patient's legs turn white. This is called the Berger's angle. So the shallow or the angle the more severe the disease. And then when we swing the legs round onto the floor, there's a reactive hyperemia, which is indicative of the tissue having a period of ischemia. Important tests to remember in peripheral artery disease are an ankle brachial pressure index. So this is where we measure the pressure in the arm as well as the lower limb. An index of 0.9 to 0.5 indicates peripheral artery disease, and less than 0.5 indicates critical limb ischemia, and something needs to be done fairly quickly about that to revascularize the limb. Other tests include an ECG looking for any coronary artery disease. Blood tests include a full blood count looking for any anemia or polycythemia that can lead to pain in the limbs. Acute inflammatory markers may indicate an arteriitis. Use and ease, looking for any renal disease, lipids for hyperlipidemia, and also glucose for any signs of diabetes. And then the next step would be to look for imaging the vessels. The next step is to image the vessels, and so the first line would be color Doppler ultrasound. As I said, this is used as first line and is used to visualize the vessel and also the flow of blood within the vessel, and you can identify any areas of occlusion or stenosis. The next step would be to use CT or MR angiography, and this gives a much more detailed picture of the limbs. It's needed if there is a surgical intervention required, and so this can help identify areas of occlusion or stenosis, and also identifies healthy vessels either above or below the occlusion that can be used in the treatment process. Treatment in peripheral artery disease includes risk factor modification, the biggest of which is smoking cessation. Others include lipid lowering using statins, hypertensive control using beta blockers, ACE inhibitors, diabetic control using things like metformin and hypoglycemic agents to lower blood sugars. Antiplatelets as well can help reduce any risk of any thrombotic events. So use of aspirin and clopidogrel are regularly used. Symptom management for intermittent claudication, exercise is actually a very, very good way of limiting that or improving it, as it encourages collateral vessels to open up and help revascularize the tissue distal to occlusion. Painkillers can help, so things such as gabapentin can help with any neuropathic pain that may be suffered, and there are vasoactive agents that can be used to try and dilate occluded vessels. The next step in the management of peripheral artery disease is the surgical interventions, and so opening up occlusions or stenosis to revascularize the limb are really important. And the least invasive of this is the percutaneous transluminal angioplasty. So this involves inserting a catheter and deploying a stent within the atherosclerotic plaque, opening up the vessel and revascularizing the limb. If this is not possible, then open surgical reconstruction using either vein grafts or artificial grafts can be used, and there are many different techniques to do this. Complications of peripheral artery disease include tissue loss, so loss of toes, fingers, distal parts of the limb. There can be intractable pain, so damage to nerves, constant ischemic pain that can't be relieved with neuropathic painkillers and morphine. Gangrene can occur, so infection of ischemic tissue, and this can lead to life-threatening infections. There can be acute limb ischemia, and this can occur in patients that are asymptomatic and is a surgical emergency. And also amputation is also a risk. So if the disease has progressed to a critical limb ischemia and the limb becomes unsalvageable, then amputation is typically the next step. So a brief talk about acute limb ischemia. So this is a surgical emergency and it can result as a complication of peripheral artery disease. with a sudden occlusion of the vessel. It's typically caused by either a rupture of an atherosclerotic plaque, potential emboli from atrial fibrillation or another source, potential graft or bypass occlusion. So patients that have long-standing disease that have had interventions then get sudden occlusion of their grafts. And also trauma can do it with dissection of major arteries. This can lead to acute limb ischemia. Symptoms to remember in acute limb ischemia are the 6Ps. So the patient will present with acute onset of a pale, painful, cold limb that has no pulses and soon becomes paralyzed and becomes numb. Treatment of patients that present with acutely ischemic limb, starting with an ABC approach and making an appropriate assessment of the patient, performing an adequate resuscitation of the patient, giving some pain relief, and also preparing them for surgery. So calling the vascular surgeons, potentially the need for imaging if the diagnosis is not clear, but then preparation for surgery is key. So taking bloods, ensuring that there is group and save cross-matched blood available for the patient as this is surgery will be taking place. And so with that, either an open embolectomy or local thrombolysis of the clot will be undertaken in theatre. Complications of acute limb ischemia include a reperfusion injury. So when the clot is removed, the reperfusion to the limb leads to toxic cascades, and this can lead to swelling of the limb and also compartment syndrome. And so this is something that that happens a lot and is needed to be watched out for within the first few hours of returning from theatre, as patients may have to go back to theatre for fasciotomies to relieve the pressure. There's a high amputation rate in these patients, as time is a very essential factor in saving the limb. And there's also a high mortality rate. So about 20% of people do die within 30 days of presenting with an acute ischemic limb. So in summary, peripheral artery disease is atherosclerosis of the peripheral vessels that supply your upper limbs and lower limbs. Smoking is the biggest risk factor and is important to help patients give up smoking to limit their risk of disease. Intermittent claudication is a classic feature and is said to be pathognomonic of it. Risk factor modification and exercise are the first-line treatments, with surgical revascularization a later stage treatment. Acutely ischemic limb isn't a surgical emergency, and it's really important to remember the 6Ps when you see a patient with this. Thank you very much.